Hi, my name is Camilo Arana. Have you ever wondered if you can get injured having sex? Well, I'm here to give you a little lesson and bring to your attention some things you should be worried about. Throughout this infomercial, I will be talking about penile trauma, vaginal trauma, and anal trauma. Let's get started. First, I'm going to talk about penile trauma. Start off by saying there are many different kinds of penile trauma. However, I will be focusing on the penile trauma often referred to as a fracture by doctors, even though there's no bone in the penis. This kind of penile trauma that's caused by sex usually occurs when there's a forceful thrusting and the erect penis slips out of the vagina and strikes against the partner instead of going back inside. Be careful. The penis might bend sharply despite the erection. People may feel a sharp pain in the penis and they may hear a popping sound. This is often followed by a rapid loss of erection. The pain and the sound are made by a tear in the tunica albuginea, which is stretched tightly during an erection. So, what to do when you're suffering with penile trauma? Usually, treatment for a fractured penis is surgery. The surgery is done under anesthesia, so no pain is felt. The most common surgery is to make a cut around the shaft near the head of the penis and pull back the skin to the base to check the inner surface. The surgeon will then remove blood clots to help find any tears in the tunica albuginea. Any tears are repaired before the skin is sewed back together. A catheter might be needed at the hospital and even when you go home. With the whole penis bandaged, you may stay in the hospital for 1 to 2 days. Next, let's move to vaginal trauma. Just like penis trauma, there are many different kinds of vaginal trauma. Vaginal trauma can occur when something is inserted into the vagina, for example, a sharp object or toy, causing penetrating trauma. Vaginal trauma can occur as a result of a painful sex experience. The most common vaginal trauma is a vaginal tear, which is just as painful as it sounds. Tears can cause pain, bleeding, and even an infection down the line. Tears often occur when a woman engages in intercourse but isn't lubricated enough. The vagina isn't as elastic as it should be, and tears and abrasions may result. So what do? As uncomfortable as they may be, vaginal tears generally heal quickly, even within hours after sex. However, if a day or two pass and the pain doesn't go away or the bleeding does not stop, check in with your doctor. To make sure this doesn't happen again, next time you and your partner hit the sheets, make sure you're thoroughly lubricated naturally. Lots of foreplay usually works, or with the help of store-bought lubricant. Next, we'll talk about anal trauma. Again, just like penile and vaginal trauma, there are many different kinds of anal trauma. The most common one, just like vaginal trauma, are tears. Like vaginal tears, anal tears happen when there's a lack of lubrication. However, this time during anal sex. Since the anus is not self-lubricated, artificial lubrication is a must if you want to engage in anal intercourse or any kind of anal play. An anal tear can be riskier than a vaginal tear because the anus contains more potentially harmful bacteria. And since the tissues of the anus are very thin, bacteria and other harmful microbes like gonorrhea, chlamydia, and HIV, for example, can more easily enter through the small nicks and abrasions and get into the bloodstream. So what do? With small tears, they usually heal up within a day or two on their own without any treatment. If you have a very large tear, it may require a visit to the proctologist to do a surgery. The small to medium tears are treated with a cream that dilates the blood vessels and stimulates blood flow to the tear. This promotes healing. So, as I explained, there are many different injuries that can occur during sex. A lot of these traumas can be avoided. Be smart and be careful when having sex. Use common sense. But of course, have fun.